you can use this model kind of for the same thing. So the first thing, if you're trying to see if you're anterior or posterior on this model, you can look at the body of the vertebra. You can also look at the anterior median fissure. So that's what I usually use. And some people like to look at the bottoms of these ventral horns, and they usually say that the bottoms are bigger. But I think that it's easier to look at this, because sometimes, especially if we're looking at a slide, the slide might not look like this. So I will start looking for that anterior median fissure. Make sure that if you have time, you make time. If not this lab, you should do it this lab, because next lab, you will have no time. You will have hardly any time to breathe because it's so much on the eye. But with this one, with this one, this is going to be the anterior horn. So here, what neurons do you find coming out of this area? Functional class, well, we'll say structural classification. Structural, multipolar, functional classification. Efferent, or you call them what? M starts with M, motor. Okay, so then right here, this is the lateral horn. So this is where you're going to see most of the time you see these in the thoracic spine. But this is going to come along with your visceral, somatic visceral area. Right here, this is going to be posterior horn. And what do you normally find coming into this area? Fibers from what? What type of neurons? Sensory neurons. Afferent. I call them afferent, so you can say the A. And then right here in this area, also find what other type of neurons? Interneurons, or called association neurons. Okay, if I were to tag, because the next quiz is over reflexes and the spinal cord, so if I were to tag this area here, what would this be on the reflex arc?
Integration center.
Integration center. Let's see. Right here, what is this called? This yellow. This is the what? We're on the posterior side, dorsal side, so it's called the dorsal root. Dorsal root. No, the dorsal root ganglion is over here. It's yellow. Like if you see, I'm about to move it in a second. So right here, this is the dorsal root ganglion. So right here, what are these called then? If this is a dorsal root, these are ventral roots. Okay, now, folliculi. Now the white matter is called folliculi, and we have 6 of them. We have 2 posterior, 2 laterals, and then 2 anterior folliculi. So make sure that you know those, and those are basically the ascending and descending tracts that go up and down from the higher centers up to the brain down the spinal cord. We do not have to break them down into like on this model. We can't break them down into like the cortical spinal tract and all that, because we don't have the different colors to show you which ones are which. So I won't ask you that, but I will either ask either on this model or on a slide, possibly, what these are. Like, what is this white section called?
Hi.
Oh, is it called the same?
That's
okay.
a fire alarm. We gotta get.
You gotta go. Okay, so right here, we're moving on to the meninges. So now we are talking about this intimate covering of the spinal cord. What is that called? Pia mater. Okay, so pia mater. So in between the pia mater and the arachnoid mater here is a space. What is that space called? Subarachnoid. What is the function of the subarachnoid space? To hold. You have to say to hold CSF. What is it called altogether, though? Spinous fluid. Okay. So actually, I forgot to ask you about this area too. What is this little dot called right there? Central canal. What is this area called right here? This whole strip. Great commissure. So right here in the central canal, what type of cells are there? Ependymal cells or ependymal cells. And then with those cells, what do those cells do? What is their function? Secrete CSF. Okay, so secrete CSF. All right, so right here on this outside mater, this or meninge, we'll say, what is this called? Dura mater. Okay, so the mother of them. And then right here, this is going to be the epidural space where you see that fat, that adipose tissue. And that is all. So with this one, What is this called? What's this area called? No, just this white. The white matter. What is it called? We just went over it. Which one?
Interior.
Which one is it though? You gotta make sure that you're on anterior, posterior.
Interior.
No.
Posterior.
So posterior folliculi or folliculus because it's one. Folliculi is two. And then what about this one? Lateral. And then this one here? Anterior. Okay. Now moving. Oh, actually, what is this right here? Ganglion. Right, you have to say dorsal root ganglion. Where's tagged? I don't know what 15 is trying to tag. I think 15 is trying to say the central canal. And then 14 is trying to say gray commissure. Because it's kind of offset. Okay.